As NBC News reports tonight, the federal government isn't even tracking cases in nursing homes, let alone doing anything about this part of the problem. Every state is on their own. And yes, states are, some of them, trying at the state level to do something. In Maryland and Virginia, the governors in those two states have made a pact to work together, even though one's a Democrat and one's a Republican. In those two states, they've now started multi-agency task forces specifically for nursing homes. Task forces that can intervene, that can come in to help, that can help with things like testing, help with things like supplies, help with things like infection control, help with things like treatment. And that's encouraging. That seems like a good model. It's Larry Hogan in Maryland who ordered it first. It's now Northam in Virginia who has ordered it as well. Those two states willing to work together, those two states both trying that. And maybe other governors would follow suit. That would be good. But that's two states out of 50, and it comes in the absence of any federal response. Ultimately, there has to be something bigger here. More than 2,000 Americans already dead in these kinds of facilities, and it is poised to kill thousands more Americans in these facilities. And we can't just let that happen. Right? We're at a critical point right now when it comes to this part of American life. We're past the point of prevention, of keeping it out of these facilities. In thousands of these facilities, it's already there. And once it's in there, it is so dangerous to these populations. Now is the time when there needs to be help. There does need to be intervention. We cannot sit back and let it happen. We will lose too many thousands of Americans. There has to be an effort to stop it. And I know apparently the federal government isn't interested in doing this, but they have to. Honestly, they have to. During the Obama administration, Andy Slavitt served as the head of the Centers for Medicare and Medicaid Services, which meant he was overseeing health care coverage for 100 million Americans. It also meant he was overseeing the type of health care coverage that most people use to pay for their stays in nursing homes and long-term care facilities. President Obama picked Mr. Slavitt for the job after Slavitt helped repair the broken rollout of the Obamacare website. Andy Slavitt knows what it means to approach the overwhelming, the seemingly impossible, and to try to fix it anyway. And so we called him tonight because he is the person I decided I would most like to talk to, at least to talk to first, about what I find to be a middle-of-the-night sit-up and worry about it issue. Joining us now, Andy Slavitt, former head of the Centers for Medicare and Medicaid Services, the host of the new podcast, In the Bubble. Mr. Slavitt, thanks for making time to be here tonight. Thanks for your expertise.
Thank you, Rachel. Thank you for your focus on this really incredible, important story.
Well, let me ask you if there's anything that I have said about it. You probably tell I feel emotional about it, like I'm head up about it, and it really has literally been keeping me up. In the way that I have been talking about it, just as a layman observing these things, am I saying anything that strikes you as wrong or that it feels like the wrong approach to this is a problem?
The only thing strange is that you're almost the only one saying it. Let's step back a second. There's 1.5 million Americans living in nursing homes today. There's about 15,000 nursing homes in the country. Many of them are quite small. And think about who these folks are. People over 80 today were born at or around the Great Depression. Many of them served in the Korean War. They have lived through so much in this country. And the promise that Medicare and Medicaid in our country owes to these people is a dignified life, a healthy life, and a peaceful existence through their last days. Sadly, this is not what's happening. The time to have dealt with this, of course, is a few years ago, not in the middle of a crisis. And in 2016, in fact, President Obama created regulations that we put through that were wholesale meant to address complete nursing home infection control, nursing home safety, overuse of antipsychotics, all these things. But sadly, in 2017, the Trump administration got rid of those regulations and said that they were not going to enforce them. That's turned out to be, I think, the root of a lot of the challenge here.
Andy, in terms of trying to get our hands around this and not giving up on this and not deciding this is too hard to do, I mean, it really does feel like an impossible problem because it feels like, as you said, a lot of these facilities are small. They're everywhere. There's nothing uniform in terms of the way care is provided or the way they are overseen. It feels like an overwhelming problem in terms of how you would try all of these individual facilities, even when you think about it at the level of one facility. Like when we first learned about that facility in Kirkland, Washington, that had a whole bunch of people positive, and then we learned that ultimately a whole bunch of people would die there. It wasn't for a lack of trying or a lack of caring to keep those people alive that things went so badly. Do you feel at all that there is a constructive way to approach it, that there is something, for example, that something as powerful as the federal government could do that would meaningfully make a difference?
Oh, this is not impossible. With people's lives on the line, you cannot go in with the attitude that this is impossible. If I were there, there's three things I would do immediately. The first thing I would do is I would test and get resources to every nursing home in the country, because we know right now that the nurses and the staff, many of them are infected. We don't know which ones. Many of them don't want to show up. So over the next 7 days, I would commit to testing every single one of them and getting gear to every single one of them. The federal government absolutely has the power to do that. The second thing I would do is I would help them. We're in the middle of a crisis. I would get them resources. I would go to Congress. I would get them resources to retrofit some of their facilities. Hospitals are not taking nursing home patients right now many times because they prefer to have them die in the nursing home. I would get I would get money for infection control. I would get resources for telemedicine for doctors to come in and talk to patients. I would get the CDC to issue guidelines so I could bring in hospice nurses, because there are going to be folks who do not make it through this, and I don't want people in this state to be dying alone. And the third thing I do is something you've talked about really repeatedly, and it's the most critical thing, and I think it extends to everything this administration is not doing right: transparency. I would have a Monday morning, Tuesday morning, Wednesday morning, Thursday morning, and Friday morning phone call with the nursing home operators in this country. We would publish a dashboard around the country of infection control record, of where there were infections, of how many people were infected, of deaths. And the way this will get fixed, and this is not to embarrass anybody, but the way this will get fixed is there are nursing homes that are doing it right. And the nursing homes that are doing it right can give guidance to the nursing homes that are doing it wrong. We don't have enough time to go back to the drawing board and create new regulations. I wish we did. But in the middle of a crisis, you get them all. I'd get them all on the phone. We'd be sharing best practices. We'd be publishing them, and we would be slowly taking down infection rates. And for those that couldn't do it, we would be moving people into facilities that could.
Andy Slavitt, former head of Medicare and Medicaid Services under President Obama, as I mentioned, host of the new podcast In the Bubble. That three-part strategy is incredibly practical and both ambitious and overdue and necessary. I hope a lot of people are listening to you to that tonight to give us hope about this crisis, but also I hope people who could do something like this are listening to you too. If they won't do it at the federal government, every state should start doing this themselves. Andy, thank you so much.
Thank you, Rachel.